Hello everyone, Dr. Harmon here. Today I'd like to talk about hemostatic netting in facelift and neck lift surgery. Specifically what it is, when it might be used, and why we might use it here at Harmon Facial Plastic Surgery. There are many somewhat bizarre, extreme versions of this technique circulating the internet, so it's something you may have seen before, and I'm hoping to get rid of some of the myths surrounding it. Hemostatic netting, also known as Auerswald netting, is described by two surgeons in Brazil about 10 years ago. It's a technique meant to reduce the risk of bleeding after surgery. It's already a low risk, but this is meant to further reduce it. The technique involves the use of stitches, the same stitches that might be used around the ears after facelift surgery or under the chin after neck lift surgery, but placed through the skin and the face and neck, securing the superficial tissue to the deeper tissue from which the superficial tissue has been lifted during a facelift or a neck lift. And the idea is that with less space in the initial recovery period between those two, there's less of a risk of blood accumulating between those spaces. This can be used in addition to drains, for example. There have not been a huge number of studies looking at the effects of this technique, but those that do exist are very promising, and so it's been adopted more widely. Now, when you look on the internet, you may see some examples where people have massive amounts of these sutures, both in the face and neck, and sometimes even up in the brows after brow lift surgery. This is not necessarily reflective of the technique. The use of sutures tends to be a little bit thinner than what you can see on the internet, and it doesn't always have to be placed in every individual or in the face and the neck. For example, in deep plane surgery, less of that superficial tissue is removed from the deeper tissue, and that's because a composite tissue is kept in place, meaning of multiple layers. That preserves the blood supply to a greater area of the face, and therefore there's less of a need to place stitches to secure to the deeper structures because less of it's been lifted. In deep plane surgery and neck lift surgery, then, the sutures may only be placed under the chin and on the neck around the drains, much less extreme visually. And it's often covered by dressing that's placed around the head. These stitches aren't placed tight, they're placed very loosely in order to ensure good blood flow to the skin, and they're not permanent. They typically come out 48 to 72 hours after surgery. Now, because there are no firm guidelines as to who should receive these, it's dependent on the individual and their individual clinical situation as to whether these stitches may be placed. So as with most things that circulate the internet widely, I caution you against looking at those photos and assuming that that is exactly the way things look or how it always is done.